bodies are not objects that are meant to be ornaments, accumulating dust or on a shelf to be, looked at or admired. Like, they are functional, right? Like, the body that we live in is called a skin bag. And I reference this in and out because it's so needed, right? Like, we need to know that our bodies are our home, and we live in our home, right? And we are comfortable in our home.
Welcome back. We're your hosts, Savannah
and Kaylin.
Hi guys, welcome back to another episode of Two Candid Cousins. We have a very special guest today, Dr. Tania. Hi Tania, thank you so much for joining us today.
Yes, thank you.
Hi Savannah, hi Kaylin. So nice to be here. Thanks so much for having me.
Yeah, of course. Now, we just wanted to give you some time in the beginning to kind of tell the audience a little bit about yourself, about your practice, your experience, and anything else you want to say.
Yeah, absolutely. So I'm a human being, and I happen to have a doctorate degree in clinical psychology. I'm a licensed clinical psychologist, and I'm based in Delray Beach, Florida, but I practice virtually through telehealth in 38 states across the nation. So I help lots of different people with lots of different challenges, improving their life, fostering positivity, balance, wellness, connection, purpose and meaning, and understanding themselves. So lots of great therapeutic work.
We love to hear that. And as everyone knows, we do have a mental health segment on our podcast, and it's very close to our hearts. So we're very, very excited to make this kind of like a mental health special with our expert, Dr. Tania. So we're going to go into some interview questions. We're going to take turns asking Dr. Tania some questions. And after that segment, we're going to go into a more casual, open discussion segment about what we talked about. So are you guys ready to get started?
Yes,
absolutely.
Ready.
All right. So we'll get into the first question. So we have 4 different topics we want to explore today. The first one is going to be body image. So the first question for this, Dr. Tania, can you please give us a brief explanation of what body image is and how a negative body image can affect one's mental health?
So body image is a really multifaceted concept, which I kind of think of as like how a person's perceptions, how their thoughts, how their feelings really about their own kind of physical appearance, their own bodily shape, their bodily size, their overall attractiveness kind of comes together to form a mental representation of how they view themselves. And it's a really complex interaction of so many different factors. And I kind of like to nerd out in psychology, but it's influenced by so many different things from kind of our own personal experiences with ourselves, our own relationship with ourselves. It's obviously influenced by the emotional kind of inner world that we have. It's certainly most definitely influenced by kind of societal and cultural standards, media representations, peer comparisons, of course. And it's really developed through the interactions with others, through our own mental representation of ourselves, which contains our thoughts, our feelings, our judgments, about our bodies and awareness of ourselves, right? And so it's kind of, if you want to kind of like dumb it down to a 101, it's kind of like how you see yourself from different areas, not just like the physical mirror to mirror, but also how you view yourself in a relationship with yourself, right? So how you think other people see you, right? And how you feel about your body. So it's a really kind of complex phenomenon that we're really not born with, right? We're not born with a body image when you're a baby, when you're an infant, you learn it. You learn it from your peers, from your family, from the press, from society, from television. And our culture really reinforces certain body image. So very complex kind of definition, but it's a very comprehensive one because, again, it's not just how you view yourself physically. It's so much more than that.
That makes a lot of sense.
Very much.
Yeah.
It's definitely taught for sure.
Definitely. And so from a negative kind of body image perspective, you mentioned, Savannah, like how it influences mental health. Well,
Yes.
a negative body image is really influencing kind of the entire person, right? So like it can manifest itself in so many different ways, where now it can be a little kind of disruptive to your life, or it can be severely detrimental on your own mental health. So we know that when somebody has maybe a negative body image of themselves, they have a lower sense of self-esteem. They may base themselves and their self-worth largely on their own appearance.
Yes.
That can lead to like a feeling of like inadequacy or self-doubt, right? And when you think of body image, and if it's a negative one, right, that really means that their sense of self is somewhat incongruent with their own sense of stability with themselves. So their sense of identity can be a little bit unstable, because again, their perceptions of themselves are now based on perceptions of others or receiving validation from others, right? And so it can kind of like wean and wax in the wind based on external forces. So we know that negative body image, we know from a body of research that it contributes to a factor for the development of eating disorders. And that can mean anorexia nervosa, bulimia nervosa, binge eating disorder. And again, these disorders are labels that we use to kind of represent a certain difficulty or patterns of behaviors or thought that people kind of, that humans experience, right? When there's something that's taken to kind of more of an extreme. And we know that disordered eating is a lot higher as well. So when one has a negative body image, there's a lot of like inner difficulties that are going on intrapsychically as well. Yeah. And so we also know that a negative body image also contributes to higher anxiety, right? Whether that's social anxiety, where maybe now your fear of being scrutinized or judged by another person, or maybe you fear like being negatively perceived. So lots of anxiety, lots of, mental health kind of struggles that if we had a neutral body image or a stable body image in ourselves, we wouldn't be feeling. So that can create to isolation, feeling dissatisfied in your body, maybe, fearing like the judgment or the criticism of others, and perfectionistic tendencies as well, right? Where now we're trying to maybe attain some unattainable idea of physical perfection that doesn't exist. So lots of different negative repercussions on mental health.
Yeah. So if you have a negative body image, that can lead to a lot of other negative factors in your life.
Yep.
And I'm glad that you brought that up. What would you say are some ways that we can foster a more positive body image just in general?
Yeah. So fostering a positive body image is a direct byproduct of creating awareness, right? So we need to create awareness that, my body image is maybe not what I want it to be, or where it should be at, right? So understanding that we need to kind of come to a place of self-acceptance, understanding that there's a lot of unrealistic beauty standards out there, right? There's a huge element of incorporating like media literacy. And what I mean by that is being really critical of media messages that promote the idea of perfection or body beauty or what have you, right? There's lots of diversity in body types and body sizes and appearances, and following, body positive influencers and having a diversity of content across social media is so important to that.
So important.
Also recognizing like the self-talk that comes about intrapsychically from ourselves, and understanding that we need to change the narrative, right? We need to maybe focus now on our bodies. Instead of being an ornament, they're actually an instrument. They're actually functional. So
I love that.
Yeah. So we're not, women's bodies are not, and men's bodies too, like I'm not genderizing, but bodies are not objects that are meant to be ornaments, accumulating dust or on a shelf to be, looked at or admired. Like they are functional, right? Like the body that we live in is called a skin bag. And I reference this in and
I
out
love that.
because it's so needed, right? Like we need to know that our bodies are our home and we live in our home, right? And we are comfortable in our home. And so when we think of, really kind of challenging our body negativity, we need to set realistic expectations that, hey, if you have health goals, if you have fitness goals, absolutely make them realistic, make them achievable, but don't focus on your appearance or on your weight. Focus on how you feel internally, your wellness, right? Your mental health, which is so important. And with that comes challenging the comparisons, right? So we know from a psychological perspective that we have upward comparison or downward comparison. Upward means you may be comparing yourself to a fitness model that has been completely photoshopped and portrayed unrealistically online. Downward comparison would mean something that is considered, in your perspective, subjective opinion, not as maybe potent as to where you are. We have to be cautious that we are now rejecting those comparisons, that everybody has a different life journey and genetics and circumstances and traumas and adverse childhood experiences. And we cannot judge based on somebody else's standards. We have to be kind and compassionate to others and to ourselves and not base that on body image. So that's a key point of, just challenging the comparison model that we may engage in consciously or unconsciously when we are consuming social media.
I love that. And I think a lot of the times it is subconscious and we don't realize it. Like we'll be watching a movie or, whatever, and we'll be like, oh, wow, she's so attractive. And, she's the typical societal standard. And then you'll see someone else who might not be and be like, oh, they're not as much. You know what I mean? So you got to stop yourself sometimes because it's internalized from society. So
so true. Another really important point is appreciating your body's own ability, right? So, like some of us are able-bodied, some of us are body limited, right? We may have maybe an amputation, or we may have, when we think of folks who have disabilities or somebody who can't do what we can do, right? We need to shift the focus from how our body looks to actually what it can do, right? Nurturing and appreciating the strength that it provides, the resilience and the ability to experience life and how it enables you to go through life. So you are not the worth of your body. Like you are not defined by your size or your weight. You are every human is a beautiful human who has internal qualities, values. Everybody is so unique, and we need to cherish that, embrace that, and appreciate our body's ability, and recognize that we need to educate ourselves. We need to kind of understand the factors that contribute to these unrealistic ideals, and notice the impact of the beauty industry and social media, and really take these to empower ourselves, to challenge ourselves to adapt more effectively, and not to feel so worn down by the concept of a low body image or comparisons to others.
Right. That's awesome. And it's good to know too that if you start with a negative body image, you can always foster it into a more neutral or positive image.
Never too late.
Yeah, exactly.
Message of the day.
Yes,
appreciate your skin
humans,
bags.
Yes, we humans are endlessly adaptive, and we over time can adapt, and we are resilient by nature, right? When we think of the evolutionary tree of how we've kind of come to be, the goal is to adapt and embrace ourselves, right? And love ourselves in a way that we're not conforming to external standards of beauty, because we know that those change over time, right? If we even look at the 1900s, right? And I even use this kind of in my individual work with folks. I say, like, just take a snapshot of the 1900s, the early 1900s, or even the 1800s, right? Go back a couple of generations and see the beauty trends back then compared to what they are now. Right. Then, and obviously we can be kind of looking at like the Marilyn Monroe versus the Kate Moss or what have you, right? Like we know that there's societal trends that change, and And yet, like when we take a poll of women in general or females in general, even men in general, right? Like go to a street in New York City or Toronto or any major, like Miami, any Tampa, any major city,
Right.
we know that people are not going to fit into a cookie cutter mold, and those expectations are very unrealistic. So we have to also recognize that what's beautiful at one point in time may not be considered beautiful at another point in time, and even country to country, right? If we go to a different continent, the standards of beauty are different than here in the US, in America, North America. So we have to kind of create awareness to say, like, you know, what is realistic and healthy for me? And what do I feel best with?
That's amazing. And I think this is a perfect transition into our next section, which is societal beauty standards. So perfect. So can you please explain to us why beauty standards are so toxic?
Yeah. So beauty standards are toxic in so many different ways for so many different reasons. A lot of times, I think I alluded to this before, but like the promotion of unattainable ideals, right? Where we often, and I'm saying we, meaning society, promotes different physical attributes that are really impossible for some people to achieve naturally. So when you think of, like, for instance, I'm very broad shoulders, I have a very athletic kind of background, and I love my shoulders and I love my size 12 feet, right? Like I was born with these things, I can't change them. And it wouldn't be realistic for me to shrink my frame or to cut off my toe to kind of fit in a shoe, right? So it's kind of like I can't necessarily kind of like conform to the unattainable standards that society strives to implement, right? And even now we have a really big shift. If you look at different models, even kind of on Athleta or any big brand, you'll notice that there's a lot of diversity in terms of race, ethnicity, even gender identity, body size, appearance. Like they're embracing diversity to really have a representative sample of the entire world. Right. And beauty standards are toxic because a lot of times they come with this relentlessness to emphasize a specific body type or a specific skin tone or feature, or people develop like a distorted perception of their bodies and focus on their flaws instead of appreciating the natural beauty that they have. So it becomes very sabotaging and very negative in that, there's like a mental health impact, right?
Definitely.
There's these unrealistic beauty standards, and now that can be contributing to elements of eating disorders or disordered eating. It can mean heightened anxiety. It can mean elements of depression that we're not meeting those goals. It can mean constant comparison to others, and that can lead to emotional distress.
Yes.
And think of like the pressure to conform, right?
Yes.
People feel pressure to conform to find a sense of belonging. They feel pressure to kind of be a certain way, and that's unrealistic given where they're at, or maybe even what their body is capable of.
Yeah,
right?
exactly.
Yeah. So,
and it makes me sad because I feel like in doing so, we're erasing everything that's unique and all these features that are so unique to each person.
Absolutely.
And we're becoming clones of the same body type, beauty standard. So
yeah, absolutely. And think of also like the toxicity of the impact on our relationships, right? Like on interpersonal relationships, meaning within people, and intrapersonal, meaning within ourselves, right? We may now feel insecure. We may feel jealous in comparison to maybe a peer or a friend or a partner, right? We develop these unrealistic beauty standards in order to conform and to meet that quote unquote societal trend or what have you. And really it's that, like there is no normal, right? In beauty, it's like we are human. I certainly didn't choose my genetics. I'm sure no human will now with genetic testing and stuff, they may
nowadays
or dyeing your hair, but really it's about embracing who you are, right? And knowing that beauty is more than just superficial. It's more than it lies in the depth of your core and your your values, your relationships, the societal contributions that you give, your kindness, right? Kind is beautiful.
Right.
Mean is ugly, as I say. Kind is beautiful. And it's kind of really about embracing yourself and not being financially exploited by the beauty industry, right? That promises certain things and that never happens, right? So there's so much toxicity, right? That even like the objectification of your body, right? Like the influence of like sexualizing a body, like a body is not even for sex, like a body is a body is a body, and it's a vehicle to live out your experience on this earth and just being okay with your body, right? Even though it doesn't fit that mold.
Yeah.
So,
Right.
Yeah.
Now, I know you spoke about being kind to yourself and, you know, making realistic goals when it comes to body image. Is there any other advice that you can give as far as making the best beauty decisions for us, or, you know, for the people, without basing them on today's toxic beauty standards?
Yeah. So I think the first thing is gratitude, right?
Love that, yeah.
Understanding that there's so much to be grateful for, and appreciating the standard that we set for ourselves, right? Like making beauty decisions in some ways that are personal and meaningful for you, and then promoting that element of self-acceptance, right? Of we all have our unique beauty, right? And that beauty is different from person to person. And a lot of times the beauty is within, right? It's like the person you are, the things that you do for yourself, for others, right? The kindness that you exude, and then prioritizing your well-being, both physically and mentally over your appearance or the external standards of society.
That's good. I like that one.
And I feel like it's important to be vulnerable and show that side of yourself when it comes to setting, you know, non-toxic beauty standards. Because the only way that beauty standards are ever going to change is if society, not just celebrities and, you know, famous people, show that it's okay to be vulnerable with yourself and to accept yourself. And sometimes that's a big issue because, you know, we know to do these things, but then we're seeing everyone else that are still acting like, no, that's not normal. You have to look like this. So setting that example is important too, as well.
Yeah.
Yeah, absolutely. And knowing that, you know, in this day and age where we have a lot of social media and we have a lot of external pulls on our attention, right? Through television and magazines and movies and TikTok, Instagram, Facebook. I mean, the list goes on.
Right.
Recognizing that people, for the most part, and I'm not generalizing, but I'm saying that for the very most part, social media is portraying favorable lights of themselves. People are portraying the shiny part of that apple.
For sure.
But like when you go grocery shopping, right, you may pick up the apple and kind of twirl it around, so to speak, to make sure that it's not, you know, hold or doesn't have a worm on the other side. But a lot of times what people are doing is that like they're taking that apple and they're just showing you the shiny part, but behind that part is the human experience of perhaps suffering or difficulty or challenge, right? Whether that's intrapersonal, whether that's emotional, whether that's within their families, what have you, but they're not showing that part of them, right? So it's very much a facade. And it's really important to create awareness of, you know, there's a lot of favorable things that are being portrayed, but we're also not getting like the two sides of the coin. We're only seeing one side of the coin. And it's really important for people to remember that, right? As they're sifting through media and digesting information that otherwise they would not want to digest.
Right.
Exactly. Also, when we go to the grocery store, I feel like a lot of the times we're thinking, what do these people think of me? What are they looking at? You know, how am I looking right now? Am I, you know, walking right? Am I just self-conscious thinking? But then you also have to think everyone else in the store is probably thinking the exact same way and focusing on themselves.
They don't care about you.
They don't care about you.
You're not paying attention.
Right.
Yeah. Calibrating that level of self-awareness, right? Like being comfortable with who you are and being authentically you, right? And maybe exuding that kindness
about it.
Yeah. And who doesn't like a compliment, right? Of being like, oh, I remember I went to a grocery store once and like one of the clerks on the floor, he was like, I really like your hair. And my hair was a mess, right? Like I barely like got put together to make that grocery run. Our fridge was empty and I was working hard and I was like, oh, I need some food. But he complimented me. I'm like, that sounds really great. Thank you so much. And your hair is amazing too, right? And like,
I love that.
No self-consciousness, right? Like we're all humans in the end, and just really utilizing that human experience as a ground for connection and understanding and understanding that we don't have to adhere to any beauty standards, right? Like we should be doing it for ourselves, not for others.
Yeah, absolutely. Now, speaking of societal beauty standards and trying to fit into that mold and being so concerned about what other people are thinking of you, I wanted to talk a little bit about body dysmorphia because, to me, that's kind of in the same realm. So could you please give us an overview of body dysmorphic disorder?
Yeah, so BDD, as we call it, body dysmorphic disorder, is, again, as a clinical psychologist, we use these diagnoses to provide an understanding of what that subjectively felt experience of the person may be, right? So it's kind of like saying Italian spices versus Mexican spices versus Indian spices, right? Like we know the oregano and maybe the paprika would belong in the Italian and what have you. Same thing for labels here in the mental health world. We know that BDD is a very serious condition that affects a lot of folks. There's a specific code for it as well in the DSM. It's 300.7. And there's specific quote unquote diagnostic criteria, right, that are involved. Now,
what is the DSM?
The Diagnostic and Statistics Manual for Mental Health Disorders. Gotcha. And you may need to double check that for me, but I'm pretty
I trust you.
Yeah. So it's very much, again, I want to normalize the experience because it comes from a very complex constellation of factors. Right? From society, from internal, from self-esteem, from parents, but it really involves a preoccupation with a perceived defect or a flaw in physical appearance that a lot of times is not observable to other people or it's not in sight.
Yeah.
Right. So when we think of kind of like being somewhat more preoccupied with flaws, right? We're thinking of specific things, right? So maybe somebody kind of thinks of, oh, like maybe my hair is not the right way, or maybe I have a pimple on my nose and people are looking at it, right? And so the primary occupation is with the appearance, right? And the appearance causes that kind of intense, maybe time-consuming preoccupation. So these flaws are really not noticeable. And again, I use flaws because we're all human, right? Like I have a scar on my cheek, I have freckles on my nose, one eyebrow is maybe lower or higher than the other, right? We're human, right? So we're not going to be this perfectly put together, super symmetrical thing. Our bodies are 3 trillion cells, and we are going to go through all these different hormonal changes that are going to contribute to things. So individuals with body dysmorphic disorder are preoccupied with their physical appearance or certain flaws. They may believe that perhaps they look quote unquote ugly or unattractive or abnormal or deformed in some ways. And these flaws are not observable to others. And even if they were, they have a very different relationship with them, right? They make it very consuming, very distressing for themselves. So concerns can range from being, oh, I'm not attractive, or I'm looking hideous, or perhaps I look like a monster, or what have you. And those preoccupations can really focus on various parts of the body, mostly the skin. They can be focused on acne or scars or lines or wrinkles or different things like the hair, whether it's like the thinning of the hair or the excessive hair. Sometimes, a lot of times it's the face, the mouth or the nose or the eyes, for instance. But any body area can be a focus of concern.
Yeah.
It's the teeth or, again,
whatever. Yeah. It could be anything.
The chin, the eyebrows, right? The whole body, right?
Right.
And so some people really are concerned about asymmetry. And their thoughts are very intrusive and unwanted and very time consuming. And so it's quite common actually for folks with BDD to consume hours, if not, hours on end throughout the day to kind of be preoccupied with it. And they usually have a really hard time resisting or controlling that urge to check. So that's one of the criterias.
So it's basically, sorry, I didn't mean to interrupt you.
No,
basically this all-consuming obsession with your physical appearance, nitpicking these flaws that you said are perceived flaws. Other people might not notice them, but to someone who has BDD, that's all they see on themselves.
Yeah. So there's the appearance component, as you said, and there's also the compulsive behavior. Right. So now we're going to sprinkle in some excessive repetitive behaviors or some mental acts like comparing, or sometimes we do like a preoccupation which is kind of like a preoccupation or a compulsion. Right. So think of like a obsessive compulsive disorder. Obsessive meaning the acts, the rituals, the compulsions are the acts and the rituals. The obsessions are the thoughts, right? Yeah. Here in BDD, we have compulsive behaviors as well, where now people may feel driven to perform these behaviors, which increase anxiety and dysphoria, right? And they're typically really time consuming, and they have a really hard time resisting the ability to kind of control that. So it can be repeatedly checking the defect or the flaw in the mirror, whether it's like combing your hair, shaving, plucking, pulling your hair. It could be camouflaging something with applying makeup excessively to make sure it's not, perceivable to other people. It could be touching a certain area that they dislike and kind of, having a dialogue with the area, like a stomach saying like, oh, like I want to get this out or what have you. Yeah. It can be anything really. And that preoccupation does cause some impairment, which is kind of the word that we use in psychology to say, hey, it's significantly distressing, right? It's causing some impairment in their functioning, whether it's their social functioning, maybe it's preventing them from going out with friends or family. Maybe it's occupational, it's preventing them from presenting themselves to work, right? If they don't have their makeup on, they can't go to work, or other areas of important functioning.
Right.
Yeah.
What are some ways that someone can recover from BDD in a sense, by basically stop obsessing over their body and their perceived flaws?
Yeah. So before I get to that, I want to point out that it's really important to know that there's different degrees of BDD. So, we have specifiers where we say a person has good or fair insight. And that means that the individual really kind of recognizes that the body dysmorphic disorder, like the beliefs with that, are definitely not true, or that they're definitely not true, or they may or may not be true. Right. So like there's a sense of like, like I think my pimple is really like distressing, but I know that I'm probably wrong on this. I'm probably exaggerating it. Right. That's with good or fair insight.
Right.
There's also something called we call with poor insight, right? Where now the individual thinks that the body dysmorphic disorder beliefs are probably true. Right. Where now the pimple is really distressing and there's nothing that they can do. And it's kind of the end of the world. So really important to differentiate that there's different levels, there's different extents. It's just like if you say, oh, I'm depressed, like, okay, you can be blue, sad, down, hopeless, right? In some ways, or you can be feeling actively suicidal, right? So there's a range, there's a big range here. And so BDD, you know, yes, there's a preoccupation with appearance, but it also comes back down to how a person views themselves, right? Like, how are they judging themselves? Are they comparing themselves to maybe themselves when they were 10 years younger, right? Are they comparing themselves to, are they comparing themselves to a neighbor, right? Or somebody online, right? And are they finding their flaws? Are they looking for flaws? Were they told that they have flaws and now maybe they've internalized those messages and it's become part of their narrative and their dialogue?
Gotcha. Yeah.
You know, a lot of times we see kind of comorbidity with other disorders as well, right? So we know that kind of through the developmental course, the age of onset is usually, the mean age of onset is usually 16 to 17 years. So think of like late adolescence, early adulthood. And the most common age when it starts is 12 to 13.
Oh, terrible timing.
Yes, lots of moving parts developmentally. 2/3 of individuals have disorder onset before age 18. So, and we know that subclinically, we know that symptoms in line with body dysmorphic disorder begin on average at an age of 12 to 13. So again, they usually evolve gradually over time before there's a full-blown diagnostic feature. But although some individuals experience abrupt onset, the disorder typically appears to be chronic, low-lying, and then improvement is documented when treatment is received and when there is supportive psychotherapy. Sometimes there's medication management that's needed, but the prevalence here is that U.S. adults, right, in the USA, adults will suffer from BDD at about a 2.5% rate. Usually 2.5% in females and 2.2% in males. So we know that out of 100 people, right, 2.5 or 2 or 3 women, because we can't have a half of a female, but 2 or 3 women will have BDD to the extent that it reaches clinical threshold.
Oh, wow.
And also like dermatology patients, we know that people who are more inclined to seek services for dermatological issues have usually 9 to 15% of dermatology patients have it, and 7 to 8% of surgery patients have it. So cosmetic surgeries will promote that. And a lot of oral or maxillofacial surgeries will also promote that at like 10% range. So there's a lot of moving parts here, and that we have to acknowledge as well.
And that's people that have been diagnosed, right? So theoretically, the number could be even higher for people that don't know about it.
Yep, absolutely. So that's basically like reaching clinical threshold. So again, if providers are not screening for it, or if maybe somebody who's going in for, you know, a derm check or maybe, you know, some form of procedure, they may not be sharing these concerns with their provider, or they may not have a safe space to talk about their internal world. And that goes unaddressed, right? And we know that the longer we wait, the more things fester and grow, and then it becomes really difficult to contain. So we know that there's a lot of shame. There's a lot of excessive focus. There's a lot of reluctancy to reveal concerns to other people. And there's a lot of times people who struggle and suffer in silence don't have the ability to say like, hey, I am struggling and I do need to talk about this, right? So I encourage, if you perhaps are listening to this podcast, I encourage you to reach out and reach out to a healthcare provider or somebody who's in the mental health industry. There's great resources online that I can provide as well at the end of the talk that I'd be more than happy to. But it's a very important topic to discuss. And again, let's reduce the stigma of pathologizing, right? This is within the human experience. And so many people struggle with all sorts of different stuff, that BDD is just part of that.
Yeah, for sure. I feel like a lot of people too are who might have BDD and it's undiagnosed are quick to say, oh, I'm just insecure. or, oh, I just worry about my
Right.
appearance too much, but they don't realize to the extent of it that it could
Yeah,
be a
because they think
chemical
it's normal.
diagnosis.
That's all they
Right.
know. Yeah.
Exactly.
Me being one of those in the past. So
Mm.
no judgment at all.
Yeah,
Mhm.
exactly.
But knowing that, our perceptions of ourselves and our relationship with ourselves does change over time, especially if we're working
Yeah.
on it, right? We can understand the influences and the sources that have contributed to this relationship with ourselves.
Yes.
And through exploration and understanding comes change, right?
Yeah.
As a human, we have the ability to change. And um, just understanding that even if you are struggling, right? I struggle with my own mental health issues as well. And we're not defined by that. We can carve a
No.
path forward, and we can have and build a different life for ourselves, and change that relationship. So it's not a forever stamp. It's not forever ingrained in your skin or in your persona.
Yes.
It's a very malleable, you can achieve full remission very, I'm not going to say very easily, but if you are working towards it and you are actively engaged, change will happen.
That's very
And
encouraging.
it doesn't
Thank
always
you.
take as long as you think it would be.
Mhm.
Sometimes a little goes a long way.
Right.
Mhm.
Right.
Yeah.
So we're going to go into a little bit of a bonus segment outside of the body image spectrum, and we're going to talk a
Yes.
little bit about intuitive eating, which I know you're very
Yes.
familiar with, Dr. Tania. So the
Yeah.
first question I wanted to ask is, what is intuitive eating and how does it differ from dieting?
Yeah, absolutely. So I'm a huge fan of intuitive eating. I had the pleasure of working with a registered dietitian, and
Awesome.
I don't know if she'd like kudos or not, but her name is Emily Stewart, and she's a wonderful dietitian. She now has a private practice, actually in Tampa, if I'm not mistaken.
Amazing.
And she worked and she could potentially even be a kind of a speaker here to go more in depth. But
We would love that.
she introduced me to kind of the concept as well, and really reinforced it. And I had known about the concept previously when I worked at Wesleyan University. Intuitive eating is very much a mind-body approach. So it's very much it's kind of like a framework, right? Let's forget about diets and specific kind of things that we need to do or have to do, right? It's an approach to food and eating that focuses really on listening to your body's natural hunger and fullness cues. And it's really about using your own internal wisdom and your own preferences when it comes to food choices. So we all have certain preferences for different foods. We all have different cultural, social backgrounds. We all have our own unique experiences. We obviously all have our own taste buds, right? And so it's basically honoring that and your medical needs, your nutritional needs, your goals, whether that's health related, whether that's fitness related. And it's intuitive eating. I like to think of it as very much like the opposite of traditional dieting, where dieting involves very strict rules that typically involves calorie counting, external guidelines for what to eat, when to eat, what not to eat. So it really differs in lots of different ways. And it basically has 10 principles. So think of it as like they dumbed it down for people to digest it. Think of it as like 10 different concepts that if you weave the concepts together, you'll create a different relationship with food. So I can certainly, I'm happy to kind of talk quickly about the 10 different concepts if that would be.
That was going to be my second question. So that is perfect.
Yeah,
Dive in.
Okay. Awesome. So, and again, I may not have this, fully in order because there's 10 principles and you can wax and wean. But the first is kind of rejecting diet culture, right? And so when we think of all of these diets out there that are so restrictive, so unrealistic, they impose so much of their own way. And here intuitive eating is like, you know what, put the whole diet to the side, and we're not going to label foods as good or bad because that promotes a balanced and very like judgmental, like an unbalanced and a very judgmental approach to eating. We're going to now promote a very inclusive environment to foods. We're going to have the unconditional positive regard for all foods, right? Whether it's the decadent piece of chocolate cake that I personally love, or the pint of organic blueberries, right?
Yeah.
Whichever it is food is food is food, right? Yes, there are different nutritional properties, but at the end of the day, it's food, right? And
right.
we have to understand that our relationship with food is the thing that really needs to change. Not necessarily what we eat, but also how we regard what we're eating.
Absolutely.
Right?
It's so hard to do.
Yeah. So the diet culture makes billions of dollars every year. And obviously, if there was a perfect diet, we wouldn't have other diets, right? We wouldn't be
right.
seeking other diets, right? So let's kind of take away, let's reject the diet culture and mentality, and let's allow for intuitive eating to happen. So the first thing that is really important with intuitive eating is that we have to honor our own biological needs, right? Food is nourishment. We know that our human body cannot go without food for X amount of days. I don't know how long it is, but we need nourishment. We need to nourish ourselves. We have a heart that's beating. We have organs that are working. We have a mouth that is talking. We have bodily processes going on. And without food, we can't sustain it, right?
Right.
So we have to honor our bodily cravings, and we have to get in touch with how we experience hunger and how we experience satiety, meaning the feeling of fullness, right? We have to honor our hormonal balance of ghrelin and leptin, right? Which are the two hormones that really dictate appetite, right? And satiety. And so with that, we create an understanding of, okay, I can enjoy this food without guilt or shame, and I know that I am hungry, right? Yeah. Or I know that I am not hungry right now. So there's a hunger fullness scale, and I can certainly provide it in the resource packet at the end. But there's a great hunger fullness scale that really takes you from 0 to 10, and you can check in with where are you at? Are you ravenous and you could eat anything in sight, or are you very, very full and you feel sick because of the fullness?
Yeah.
So we want to kind of put a quantifiable number of honoring our cravings and honoring our hunger and fullness. And that starts with, which leads me to the third principle of really creating kind of like enjoyment for food, right? So as we're eating, we want to focus on the pleasure of eating, of savoring that food, right? Food is a very intimate relationship. We are ingesting something into our bodies, right? We are welcoming a foreign substance and feeding ourselves with it. And that means enjoying the experience. So I joke a lot. I used to have a friend who was a fitness enthusiast, and he wanted to become a bodybuilder and what have you. And he was eating egg whites and broccoli morning, lunch, and dinner, right? Or he would mix it up with like a piece of salmon or chicken breast. And it was always the same thing over and over and over again. And I knew that I knew exactly what his diet was like. There was no enjoyment of food for him, right? He didn't focus on the pleasure of eating anymore. And so you can imagine he had an aversion to those foods after a couple months of eating that. So we want to enjoy the food that we're eating. And we live in a society that is so abundant with different foods. We can just take a stroll to the grocery store, Walmart, Publix, what have you, and Whole Foods, see like so many different cultures and textures and scents and aromas and colors. And we need to really kind of embrace food for what it is and find enjoyment in it.
Yeah, absolutely.
So that's an important point. The next important point is body respect, right? And so intuitive eating really promotes a lot of respect and body positivity. And it encourages people to really accept their bodies as they are, not judging their worth on weight or appearance. Respecting your body for what it's doing and respecting your journey, right? So all of us have different journeys in life, different circumstances with family members, with genetics, with peers, academics, right? We all have a journey, and sometimes we may engage or have engaged in emotional eating or, quote unquote, poorer healthy choices. And as a result, we are who we are today, right? And so intuitive eating focuses on respecting your journey, your body, having an acceptance of where you are, and knowing that, hey, if you want to change that in the future, if you want to change your body composition, nothing prevents you, but you need to do it in a sustainable, healthy, happy way, right? That is based in respect for yourself, right? Yeah. And so with that, we create emotional awareness, where now we're understanding the emotional pulls of perhaps eating from a place of emotion, where perhaps we're binge eating, perhaps we're eating beyond when we're full, perhaps we're coping with emotions through eating food, right? Maybe we're trying to repress the void, or maybe we're trying to feel better by eating. But are we physically hungry, or are we emotionally hungry? Right?
Good point. Yeah.
And so in my work, I really think of incorporating the elements of, okay, let's understand your hunger, right? Like, is it really biological hunger? When was the last time you ate? And if it isn't biological hunger, it must be a different kind of hunger and thirst.
Right.
And a lot of times that's
I love that.
the emotional need that comes up. So that's another principle.
Happens to me when I'm bored. If I'm bored, I get hungry. I'm like, let me find something for me to do.
And that's like listening to your body, right? Like maybe your body is encouraging you to eat, but maybe boredom, you want to be stimulated with something else. So just paying attention to your body's like signals for hunger and fullness and satisfaction, and then stopping when you're feeling satisfied. And even if that means grabbing a doggy bag home, or even if that means, maybe stopping halfway and sharing your meal with someone else, like, you can definitely, just listen to your body a little bit more and reject those rules and honor your cravings and focus on emotional awareness, respecting your body, the enjoyment of food. And then the very last concept is health from a holistic perspective. So intuitive eating is not a weight loss strategy. It recognizes that health is more important than just physical health. Mental health also matters too. And it considers the mental and the emotional well-being of a person as a really integral part of overall health. So while dieting focuses on external rules and restrictions and deprivations and food labeling, right? Good food, bad food, or focusing on weight, like how much do you weigh and a specific number, or short-term results, intuitive eating focuses on all of the opposite of that. So emotions are not ignored. Body image is embraced, and that a positive body image with yourself, with your relationship with yourself, is reinforced. It's just such a beautiful, like, freeing framework that we are so not used to in this society, because again, we grew up with so many diets and so many different labels.
For sure.
Yes.
Yeah. Thank you so much for sharing those principles. It's very, very helpful. And I wanted
to... Oh, sorry.
You're good.
I was just going to say, I've heard of intuitive eating and I've practiced it somewhat, but it's interesting to hear everything that backs it, because it's deeper than what people make it out to be,
Yeah, definitely. I do follow intuitive eating now, thanks to Dr. Tania. And it has been, like you said, it's been so freeing, because my whole life I attributed morality to food. Like you said, good food, bad food, stay away from the bad food, only take in the good food. And that leads to that mindset of just restriction. And if you can only restrict for so long without binging or going crazy, because, our bodies aren't made to just, restrict things like that.
No.
But I definitely have noticed a difference in my relationship with food since I started it. And, sometimes I do still struggle. I'm like, should I really be eating these chips? I know they have food dye in them, and you know what I mean? So it is a struggle sometimes to be like, okay, should I choose this for nutritional value, or should I choose this because I really, really want it? You know what I mean? So just finding that balance, like, even if something doesn't necessarily have huge nutritional value, it can be okay to eat in moderation, some of it.
Yes.
And I think that's scary for a lot of people,
As I heard a TikToker say, eat what you want and eat what you need.
Yes.
Yeah.
And I love
So
that
true.
motto.
Yeah. I feel
And
like
it's so
balance
true.
is a huge part of it. So
Yeah. And like we think of even like the registered dietitian also kind of endorses it, like 80% of the time make choices, right? At any given point, we have a choice as to what to eat and kind of what to feed our bodies. And 80% of the time, make those healthy choices that you feel are appropriate. And hey, 20% of the time, give yourself permission to also have that chocolate cake and indulge and enjoy and celebrate with friends or family, or enjoy something that you've been craving, right? Because we know that deprivation is actually a catalyst to wanting, craving, desiring more. And so that's a really important concept in this journey.
And I've noticed the less that I restrict and the more I allow myself something, the less I need of it.
Yeah.
So like, dessert, for example, I'm like, oh, I'll just eat, half of this piece of cake and I'm happy and I'm satisfied,
Yeah.
Right.
Definitely.
Especially when you want cake again, you can have cake again. Because
Yes.
I feel like in the past when I've dieted and I'm like, I get one cheat day, then I always go all out and I eat like way too much of it. And
Exactly. Exactly. So we've kind of moved into the more casual, open discussion segment right now. I did want to share a little bit about my personal experience with rejecting beauty standards real quick, and maybe we can, all talk about that. So as I think you both know, I used to be blonde for a very, very long time.
What? I had no idea. No.
I was known for my blonde hair. I was one of the only blondes in my church growing up, and I am a natural blonde. However, my hair started to darken over time. And I remember thinking once my hair started to darken, oh no, I need to lighten this right now or no one's going to want to date me. Like that was the first thing that came into my mind. So for, oh my goodness, like over 10 years, I would dye my hair blonde just because I felt like it made me more attractive in society's eyes. I felt like brown hair on me is just like plain, it's boring. Like no offense to anyone with brown hair because I have it now too. But I used to just reject that and be like, I feel so mousy with it. I don't feel like I stand out that much. So, a few months ago, one day I was like, dang, I am not doing this anymore for me. I'm doing this for other people. This is ridiculous. And I'm wasting a lot of money and damaging my hair by doing this. So I put an end to it. I went to my hairdresser and I said, I want to be brunette. And she was shocked. But she did it. And I feel so much better now. I feel like a more authentic version of myself. My hair is healthier. I spend less money at the hair salon. It's so freeing to be able to.
So well.
Thank you. I do truly love it now. I feel more like myself. But yeah, just little things like that where you can go like, I reject that,
Well,
honoring your truth.
Yeah,
right.
Definitely.
At the young age of like 13-ish, I was so self-conscious about being a redhead and having freckles, and people at school used to make fun of me for being so pale. So immediately started dyeing my hair, went straight to black, by the way, which just did not help with the washing out. And, wearing like baggy hoodies long pants so my skin wouldn't show, and just like the extreme measures. I'd be outside in 90-degree weather with a hoodie on.
Yeah, she would.
Seriously.
Oh my goodness.
Come
along. And I can relate to that as well, like honoring your authentic self, right? I think I was telling Savannah at one point, I was like, I have really big feet. I have size 12 feet, right? Like my parents gave me some really interesting genetics, and I honor it, right? I work with myself, and certainly I could, see a podiatrist and see what I could do to diminish the foot length, but I honor that. And I think just honoring yourself and, who you are and your authentic self is just so important. And even like letting your inner beauty and outer beauty shine, right? Whatever that authentic self may be. And it's important for folks to kind of get to that point where they accept themselves, right? And they no longer put on a show for others, but they're living a life that is rich and meaningful for themselves. So
Definitely.
I think everybody can relate to their own personal experience in that way.
Yeah. I think what it comes down to is, well, what really changed for me was when I started to love myself, like actually love myself, not just the external part of me, but when I started to realize, wow, I have a kind heart. Wow, I have a lot of empathy for people. I, am sensitive. I'm caring, just like really focusing on the internal aspects that are, good qualities in myself really helped me like not care so much about the external.
Right.
Yeah.
Plus, I feel like it was a little more difficult too in your case because you had to not only learn to love yourself, but also find yourself at the same time.
Oh, yeah. It's been a journey.
Yeah.
That's for sure.
And I think we all do, right? In some ways, like we have to understand ourselves, but also reinvent ourselves, right? To kind of break through from those societal molds or even the expectations of parents or family members or peers, right? Like we don't have to conform. We don't have to disrupt our own kind of sense of self to meet another person. So honoring yourself is such an important of leading an authentic, meaningful, rich life. And I encourage everybody to embark on that journey of self-exploration, right? Reach out. There's so many wonderful mental health counselors available online, in person. Even if you're in a university setting, there's free counseling services at school. Typically they have folks available, and find a good fit. And once you find a good fit, go with it. So takeaway messages: honor yourself.
Definitely. I just wanted to discuss one more aspect, unless y'all had something else to talk about. I wanted to explore BDD a little bit more through my personal lens, and I know Kaylin as well, if you're comfortable sharing.
Sure.
And I feel like for me personally, once I realized I had BDD, it kind of opened my eyes and it changed everything about my life. I could look back and connect the dots. And, like Kaylin said before, we're conditioned to kind of think that it's normal. It's just a normal version of insecurity, but it's not. Like you said, it consumed. I mean, it still does sometimes. I would say I'm kind of in recovery. I'm getting there. I have that awareness, that these
like
flaws
Dr. Tania said, we're all human.
Exactly. It's a daily struggle. But at the same time, I also have days where I go to the grocery store and I feel like an absolute monster. And I feel like, the ugliest, most deformed thing that walked the face of the earth.
Oh my goodness.
And that everyone at the grocery store is just staring at me and laughing about how disgusting I am, which to a normal person sounds a little, out there. But that's just, my daily life, and it really is a struggle to just push those thoughts out of the way and be like, they don't care
Break out
that
of
much.
that mindset.
Yeah. And even if they did care that much, what does it matter? I know my heart.
Who
I
are
know
they
that
to you?
Yeah.
What is their
Exactly.
opinion? How does that affect you?
Exactly.
For me, I realized that I had body dysmorphia disorder whenever I started looking back at older pictures of myself and not thinking, wow, I looked so much better, but actually thinking, wow, I thought I looked disgusting this day and look at how great I looked.
Yes. Happens to me all the time. Even with the podcast, I'll think while we're filming, like, oh my goodness. And then a few days will go by and I'll watch it and I'll be like, oh, I look kind of cute that day.
Yeah, I'm actually cute.
Yeah.
Yeah, and that's such an interesting phenomenon that a lot of folks report subjectively from their experience that, looking back at something, their perception is altered, right?
Yeah.
It's kind of like in the moment, we may view it a certain way. And then in reflection, we actually have hindsight and we can say, well, actually, my perceptions were not so aligned with how I'm perceiving it now. And that's where like doing your own inner recovery work is so important, because as people continue to experience, right, and like BDD may be present for different reasons. We know it's not just self-inflicted. There's a lot of different factors that come into play. It's a very complex phenomenon that typically manifests itself over time, as I said previously, and has a different developmental course through time and through space. And there's an element of recognition of like how it impacts us. Right. And recognizing that the impact is pretty significant in some cases. And some other days it may not affect as much, right? So being able to kind of understand, and there's different techniques and different resources that I can provide as well for folks who are interested in kind of quote unquote helping themselves or may not have access to mental health services, but being gentle with yourself to know that a lot of times it is inner recovery work that needs to be done. And that process of understanding how that came to be does take time.
Right.
Yeah.
And I learned like changing my environmental causes for mental health issues really helped me get out of that fight or flight state of mind. And that's when I really was able to sit and focus and say, okay, now that I have those things, like external things, factors out of the way, now I can look within myself and actually work on myself internally. Because I feel like a lot of the times we say, we're working on ourselves, but we're really working on work, family, household, which are all important as well, of course. But it goes a lot deeper into really like looking within yourself. And like we like to provide shadow work questions normally with our segment. That's for the purpose of really reflecting internally and not just focusing on the outside factors of your life, but how you feel during things and mindsets that you have that need to be changed, basically.
Yeah, and that requires creating a space, right, for reflection.
Yes.
Because life is really busy and there's lots of moving parts and lots of different responsibilities and pulls and pushes. And unless we really dedicate time for ourselves to go inwards and to sit with ourselves and reflect, and again, like having, a compassionate, caring person on board can definitely help with that, but also creating time ourselves in our day-to-day life.
Oh yeah, for sure.
It's hard to get that me time in sometimes. It really is.
Yeah.
Especially I'm over here with a toddler, so pray for me.
Well, this has been great. We're going to wrap it up on that note. Thank you so much for coming on here, Tania, and being vulnerable and sharing your expertise and your experience. It was very
It's been
needed.
Wonderful.
Yeah, absolutely. My pleasure. Thank you, ladies, for having me. And hopefully this information was helpful. And, if there's any resources, I'll certainly provide them to you as well. And you can post them online. And for folks who may be
we'll try to link
interested,
some stuff in this description here for everyone listening.
Absolutely. And feel free to reach out. There's lots of great mental health services out there. So if ever you need to reach out to me so I can provide some community resources for you, feel free to do that. I'm always wanting to help folks who are struggling and who want to optimize their experience in their life.
Yeah. Amazing. Well, thank you everyone so much for watching and tuning in to another episode. We'll see you guys next week. Bye.
Bye.
Bye.